Hi, everyone. My name is Jessica Barch, and I'm a Senior Community Program Manager for the Parkinson's Foundation. Welcome to our 2022 Midwest Care Partner Summit. We're so happy to have you all join us here in person today. And whether you're watching from home or here, we're just so happy to see your faces. So before we get started with our presentations, I would like to share some information with you. The mission of the foundation is essentially to make the lives better of anyone who is affected by this disease. Whether you are living with Parkinson's, caring for somebody with Parkinson's, or working to end this disease, we are here to support you. The Parkinson's Foundation has a wide array of free resources. We have educational books, a podcast, our Aware and Care hospitalization kit, a helpline staffed by experts, our website parkinson.org, and more. In addition, we will send a follow-up email to the registrants of today's program in about a week from now. This email will include slides from the program, as well as information about the resources discussed today, and a link to the recording. Also, please note in your folder, for those of you who are here in person, there is a resource order form that you can fill out today and leave in the white bin at our registration table on the front. In addition, we have set evaluations on your table. So if you're able, please take the time to fill those out today. We always want to know what we did well and what we could do better. And those could also be placed in the bin on the registration table as well. And for our online viewers, immediately following the program, an evaluation will pop up on your screen. And if you are able, please fill that out and let us know how we did as well. I also want to inform you of our wonderful Zoom series, PD Health at Home. This weekly series is held on Mondays, Wednesdays, and Fridays, and focuses on mindfulness, wellness, and fitness. To learn more or to register, please visit parkinson.org/pdhealth. I also want to highlight a study for people living with PD that can participate in from your home. The TOPAZ study will test if a medicine can prevent fractures in those older than 60 living with Parkinson's disease. If you qualify, a nurse will come to your home and you'll receive a one-time treatment. Call our helpline at 1-800-473-4636 to join or learn more. And before we move on to our first presenter, I'd love to thank the generous sponsor of today's program, Acadia. On behalf of the foundation and all of our care partners gathered here today, thank you to everyone at Acadia for your generous sponsorship. We so appreciate all you do to support our mission and to make lives better for everyone impacted by Parkinson's disease. Thank you. And now it is my pleasure to introduce Alicia Peters. Alicia is a person living with early onset Parkinson's since 2018. She was diagnosed at the age of 45. She has been an instructor at the College of St. Benedict and St. John's University in St. Joseph, Minnesota for the past 10 years. She received the Minnesota Higher Education Art Educator of the Year for 2021-2022. She is grateful for Nick, her spouse of 26 years, who has joined her today, and her daughter and sister for their support during her diagnosis. Alicia, we're so happy to have you here today. And Nick, also, please take the stage.
Thank you. Okay. Thank you very much. Thank you. I always tell my students to embrace the struggle, so I'm going to put my notes there and look at them if I need to. I do want to introduce my amazing spouse here with me, my care partner, right? Nick Campbell. We have known each other. He doesn't like to remember all these numbers, but I loved remembering our first date, which was this month, 31 years ago. So yeah, at 19, and I can't think of a better person to be going through this journey with. He is my Renaissance man, I like to call him. He is a photographer, he's a videographer, he's a care provider for folks in need. He's got an amazing brain that is always looking for solutions. And I see that in my daily care also. He's always looking for those solutions. So I'm very grateful for him. I don't know if you want to say anything else about yourself or.
I really don't want to say anything more about myself, but I was lucky enough 30 some years ago.
31.
31. And I
Yeah.
can get away with that because she let me have the pass.
Yeah.
She randomly showed up in the back seat of one of my friend's cars.
Oh, yeah. Yeah.
And she introduced herself, and we've been together ever since.
Yeah.
So that was just kind of a random act of kindness, craziness.
Yeah. Craziness.
But here
I
we
would
are.
say craziness, definitely craziness. So our slides, and I got to get the clicker here. Let me get this going. There we go, this way. What I wanted to start talking about first is I'm grateful for the gift to be able to do this today, because it really gave my spouse and I an opportunity to talk deeper about what this means to be in this journey together. And it was really quite beautiful of a conversation that we've had over the last week. And one thing we kept coming to was this idea of the gentleness of Parkinson's. I know it's hard to think of that sometimes, but it's easy to go to the what ifs, the what ifs, the what ifs, and we have time. We have time in this journey. And so we talk a lot about embracing the gentleness of this journey together, that we do have time. It's nothing's going to happen instantly to me. The taking advantage of the present, we talk a lot about. I have moments where things are presented to me and I just go for it, taking advantage of those present moments. And then it's a slow process, and embracing that also, that we have time to go to the next step in this journey and the next step in this journey together. I mean, we raised a child, we can do this, right? We can do this, right? And to give it to the power it deserves, really, because he's really good at putting that back into my mind. We have time. We have time. If you want to say more about.
Well, first of all, I just want to apologize for wearing a purple shirt this close to Green Bay. I am from Minnesota. I knew I had to wear something nice, and this is nice for me. So just so you know, so have a little sympathy for me today. I'm as much of a Vikings fan as probably you guys are. So let's just get that out, out in the open. The biggest thing, I think, for me personally, when the diagnosis came down, obviously, she was diagnosed early, and I think we were both kind of instrumental in saying, hey, maybe get that tremor checked out. I just think that might be something to work, not even thinking Parkinson's, not just like, hey, let's check it out. And then getting the call after having some testing done, that yes, it is Parkinson's. And I was like, okay, okay, at least it's not in my mind, I was thinking, coping, like, at least it's not a brain tumor. At least it's not something that's going to just, take you away right now. And I think that part helped me. And it also it allows you kind of slip in denial really early on with especially as a care partner. It's really easy to be in denial early on. And I think that's okay. But I think there's a point where things need to shift, and you need to start finding coping mechanisms to help yourself so you can be an asset and a resource for your person. And I think that was, I come from a little different background, and my brain works a little differently than hers. She tends to be a little more emotional, very positive trait. Let me just say that, very positive trait. I'm a little more logistical and analytical. I have a motorcycle racing background, and one of the things with that is I would train young racers how to go fast on a racetrack. One of the first things you learn is you need to go slow to go fast, and not to quote Ricky Bobby or anybody like that, but that's one of the things, and nobody wants to do that. We always want to get to our end goal right now. So convincing people to take advantage and really pay attention of where you're at now. So that perspective, okay, this is where we're at. This is what we're faced with. That's something I had to wrap my head around, something I've been training all my life. That's how I handled every stressful situation. I own a corporation that does adult foster care for adults with special needs. And that's you're dealing with all kinds of ranges of cognitive and physical, disabilities. So you're always trying to find new ways to help somebody feel more independent and in control of their life. And it takes a little bit of thought, because you're going to screw it up, and you got to be aware of when you're going to screw it up. So when I had to finally actually do this with my wife, I had to really think about, what's the perspective here that I need to keep hold on? So that's a big part of what I brought to the table and what I needed to bring to the table to be successful with you.
With embracing the gentleness.
Yeah. And that was one of the big things that I trying to convince her, who rightfully so panicked about what the end goal is, or, sometimes we're focused on our desired outcome, want to go fast, or when we look at folks that are on different places in their Parkinson's path, it can be scary, especially being in the beginning. And knowing that, listen, regardless of where you are on the path, that's where you are. And you have to embrace that particular part, because that's you, that's your independence. And that's where all of your strength lies. And so instead of like ramping forward and saying, hey, let's really focus, let's worry about this, let's take advantage of what we can do right now. And providing that support was, that was just, I felt like that was my job, to kind of bring that in and actually help kind of reel in her, so we're not focusing too much in the future.
Yeah. Yeah, no, that's exactly, yeah. So, and that ties into the next, which is to reach for the mindset, not the miracle. There's so many times that I would give people right away when I was diagnosed in 2018, here's this thing, have you heard of this thing? Here's this thing, have you heard? And it's really easy when I'm in that mindset of fear and of what the future is going to bring, to go, oh yeah. And instead looking at the now and what I can do right now to avoid that temptation, and work with taking that control. I have many different ways that I cope with this. There's many ways that in my daily life. And when people come up to me and they say, have you heard of this thing? Have you done this thing? I'd say, what helps me more than anything? And I always say, donate to the Parkinson's Foundation. That's my thing I say all the time, because I tell them, I said, the Parkinson's Foundation helps me every single day. Every single day, the price of my meds, the care that my care provider is through the Parkinson's Foundation. It's like every day I benefit from that. This is the best way to help me. So I said, instead of the snake oil, donate to Parkinson's Foundation. With that also, I'm really involved in the foundation. This is my team here. On the for moving day, we're called Straight Outta Dopamine is our team name. Yeah, it's my sister. She's pretty creative with that, which I'm so grateful for her support. Also, she's right in front there. But that has been a way that I've coped, is to really be a part of the Parkinson's Foundation, to be involved in it, to talk to others about it, being really open about my diagnosis and being open about my journey has really helped me and others. And I've been connected with so many different people because of that. And we all have different ways of coping when we are faced with something like this. I also heard one time that the minute you go to Google, the mindset is to go on a walk, right? So I tried to keep that mindset in place also, because what I would find out in Google would not help me, but a walk. Let me tell you that there's research behind that, and I'm going to go on a walk every time. I also started this piece for me a couple of years ago. I started my doctorate. I said, this is what I want to do. I went to my doctor and I said, I really want to get my doctorate. That's a goal of mine. And he said, we will do anything to help you get that, Alicia. We'll do what we need to do to help you get that. So I'm almost done with that. I got a year and a half left of that. And I feel like, yeah, it feels good. So I've been setting more goals that are attainable in the next few years, right? What can I do now? My friends also know I have this monthly, I don't know if it's like F it kind of thing, like just kind of a thing just to go for it. And if something presents itself that I've never tried before, I'm like, yep, let's do it. Let's do it. And every month I try to do something different also. And it helps me stay with the mindset of coping for me. I don't know if you have any thoughts on coping.
Yeah, the big thing that we've worked on, I think, together is really taking advantage of where we're at, and also the talking and creating. I as a care provider, and I'm this is my first time speaking on this, and I feel just honestly so kind of overwhelmed and honored to be in this room. I've been lucky enough to be with you at events, but this was, hey, can you drive me to Milwaukee, and hey, bring a purple shirt kind of a thing.
Yeah.
So that's, where, just the idea of being a care provider. I knew that, the part of my coping was going to be having to need to be, earning her trust and not micromanaging her, but finding ways that I can help and just really seeing things for kind of the nuts and bolts of what we're dealing with today. Because any one of us can, just driving here in the rain last night was kind of sketchy. So, nothing's promised, right? So we really need to embrace the right now. And I've had multiple concussions, so sometimes just remembering things is really, really tricky for me. So I really am kind of like Dory the fish in that movie, where I'm just like, I just don't remember much. So I really enjoy the present. And I think there's a lot of strength with that. So that, and I, trying to convey that to you and trying to help you find a way to not worry. It's okay to be knowledgeable about what Parkinson's can present, but to not worry and not let that wreck today.
Absolutely. And that brings us to safe spaces, places where the terrifying things can be okay. I have a amazing group of young women, I say young, they're my age, they're maybe watching right now, that I found because I've been open about Parkinson's and about my journey. I found a friend that lives right in St. Cloud with me, same age, who has Parkinson's, and then also another woman in the same age in Minneapolis that has Parkinson's, and we get together quite a bit. And it's a place where I really can have those conversations that can be really terrifying, and we can have those conversations together more than I can with a lot of other people in my life. It allows us to be open and vulnerable also with each other, which has been, and laugh. Like, we laugh so much also. And we have children, we're working. So we share a lot of those experiences, and those safe spaces have been really important. I know that my daughter, who is 19, her safe space is dad, and she always goes to him right away and asks him and asks him questions, which I love that she has that support also, because she worries. I have up there because she worries about missing days. She says something about like the best times of mom's life. I don't want to miss them, and she worries, and it breaks my heart because I want her to live her best life. But I'm so grateful she has a safe space with Nick to talk through those things. And I think Nick started talking about the reasons we don't share our fears and we don't share them. Sometimes it's we don't want to burden the person in our lives. And we, as a person living with Parkinson's, sometimes I don't want to share those fears. I just this past week, we were at a doctor's appointment, and they asked me to walk on my heel, and I couldn't. I stood there. And I just stood there, and it was the first time I realized I couldn't do that. And I didn't say a word. And I didn't say a word because inside I was terrified. I was terrified that here's another sign of something that I didn't know was there before. And thank God, in my head, I was right. Okay, I don't want to burden Nick. I don't want to talk to him about it. And he immediately said, "What's going on? I can see something's going on." And I was able to share that because, and the other one is the fear of what the response may be. And he makes it able for me to share those terrifying things sometimes. And I really appreciate that. It's because there are conflicts when the symptoms progress and you're not sure. And I always ask for him too. And especially my sister, I'll ask her the same thing, because there are things that I do in my life that I don't know I'm doing. You start to adapt your world and do things like my face. I said, if you notice something different in my facial expressions, I don't think I would notice that as much. Please let me know. So I try to be open about that in those safe spaces so that I can deal with what's happening right at the moment. Safe space. Yeah.
Yeah. So one of the things that we've really worked hard as a family, that you brought up Lydia, our wonderful daughter, who's hopefully watching at home right now, is being able to kind of face your fear. Like, what is your fear? and that's okay. And now the big thing after that is, what's your plan? And because I've had plenty of fears, we knowingly take on things that are fearful for a desired outcome. And now it's, what's the plan? And so when I talk to my daughter, and when I talk to you, I have to make sure that we can address our fears, but we also have to address, okay, what's our plan? What, even with as you start to notice certain things that become limitations, that might be, having a great discussion this morning at our table about, limitations that kind of come and go based on medication, based on the day. Acknowledge it. What's your fear? Have a plan. And having that gentle plan for that, I think, makes everybody feel so great. And the one thing I've learned that in the beginning of this whole thing that I really embraced, and now I really don't like it, is the whole, this is your best day, like right now. I think, and with a mindset of accepting each little step that happens, you adapt to it and it becomes your new normal every day, regardless of what level you're at. And the sooner you can get on board, so that really every day can be your best day. This is not a clock ticking backwards as far as happiness, as far as enjoyment, fulfillment in life. Mm-hmm. And I think that mindset has changed for me just in the last year. Mm-hmm. Because I used to feel compelled to, like, we got to take advantage of this. You're still upright. Other than, some tremoring and some other things that you're keeping to yourself. No, it's like, no, we're gonna take this path with you, and whatever presents itself, we're going to be with you, and we're going to preserve your integrity and your happiness and your fulfillment in life. And that just takes a little bit of work on both sides.
That made me think of when Lydia was little and she would drop the cup on the ground. And how as a parent, you're like, okay, don't, you put it back up, He said, let's just embrace this moment because it's going to happen and then it's going to be gone. Right? She'll go into something else. And I think that's that same idea. This is happening. Let's embrace it. And then we'll go on to the next thing. This is our daughter, 19 now, preserving dignity and how care partners can help. We've talked a lot about that already. I want to just talk about modifications a little bit with that, the dignity around that. There are a lot of things that as a person living with Parkinson's, we start to create habits around because we're trying to modify for different things. Like eating has been challenging with my tremor, and I found my face was really close to my plate. I didn't realize that was just a habit that I started doing, was how close. And it was my spouse that said, hey, do you know that you're really close to your plate? And I'm like, no, I didn't really realize I was doing that. And then we started talking about different modifications I could use to support. So without even prompting, the dignity of how he handled that was quite beautiful. The next day we had all new silverware that I didn't even know was happening, beautiful weighted silverware that, I can use it. Then we talked about modifying maybe my elbow on the table, which has really helped with that also. So I consider those things now, and the dignity in just being out in public instead of being, my face in my dish. I have supports in place. I bring my silverware with me. I bring it to work with me. And that was a real supportive modification. And I love this quote that you said was, me doing something for you is not a modification.
I don't remember saying that.
You did, you said that. And my daughter is very empathic. She feels all of it. And she worries about me. She sometimes gets embarrassed with things in public a little bit. And so she'll jump in right away at home and try to help me. And I know that's where she's at with empathy, but how do care partners help?
Well, I think you hit it, the nail on the head, and that's, those gentle little modifications that, that you can do throughout the day, that make those differences. So that my end goal, and I'm always about desired outcome. Like, what's my plan 10 years down the road? To feel exactly the way I do right now about her and about us. And I want her to feel the same way she feels about herself and us 10 years down the road. I don't care what is presenting itself. And if we do this right, and we have the right support, and we actually put some time and effort into it, we should feel that way, and I feel for, and we talked a little bit about, because we've all watched all these videos of people that just, whether it be, somebody, from a previous generation where it just, you didn't talk about your feelings, and now all of a sudden, you're a couple and you don't have that connection, and somebody is really, really struggling. Both people are really struggling. And the support is just not there. I have so much empathy for people in that situation, but I do think it's a mindset that we choose. So I think, I've been lucky enough to have experiences in life that I can associate. Oh, this is just like when I watch you bake cookies. Okay, the way you put in the ingredients and the way you melt everything together and you sift the flour. I just stick stuff in a bowl and I mix it up, and they don't taste right because I want to get to the finish line now. And she makes it with the same stuff, and it's just like, wow, that just kind of melts in your mouth. And is that baking powder? That's amazing. I don't know. Whatever, nutmeg. But it's that those little steps and taking care along the way that really make a difference in the end result. And that's what I want in 10 years. I want good cookies.
So we have 5 minutes. Yeah. Hurry up. Passing along the power. My daughter coined that phrase, and I thought that was quite beautiful. When I was talking with her about it, she goes, "Dad taught me to pass along the power when it comes to communicating concerns, doubts, and disbelief." So she said, "I do that by asking you questions, Mom. How are you doing? Where are you at with this?" Instead of her telling me where she thinks I'm at. She wants to hear it from me. And I thought with that pass along the power came up. I thought that was beautiful way to put that, right? Pass along the power. People offer advice. They care. They care. Ask for your care partner. And I already talked about these things. That's wonderful. Good. And that's our team and my friend who's also has Parkinson's. So this is my guy on a motorcycle. I had to put it in here because it was kind of that kind of that metaphor around like going slow to go fast, going slow to go fast. You go slow to make it around the next quarter. We have the foundation, I feel like, to make it work and to chip away slowly at it. But I do want you to talk more about the relationship dynamics around this and us and how to maintain it.
Well, I think we're winging it, right?
Yeah.
We're winging it with 30 some years. Yeah. And I can tell you, I mean, we're a younger couple, I guess. I just turned 50. I'm not sure if that's young, but we've been together most of our lives, and the journey that we've had as a married couple, take out any diagnosis. There's been so many ups and downs and so many challenges and so many things that just everybody is faced with. That I think the one strength that we've had, and we've actually really kind of used this diagnosis a little bit as a real, like a wake up call. Like, wow, I 20, how many years ago did we get married? 26 years ago, we were wonderfully married.
Yeah.
I committed myself, for better, for worse, all the words, right? Mm-hmm. And not really thinking that we were going to be faced with something, but it's supposed to be the best day of your life, so you're not thinking of that. And now you're tested, and you're like, I just think it's an opportunity to be your best for someone else. And I feel very privileged to be in the position that I am with you. I feel very responsible, but I also feel like my biggest responsibility is that you feel like you stay the same person that you are, and that you're not a burden, and that you're not anything other than just, you would do the same for me. And I think everybody in here can probably relate with those kind of sentiments. And what we're talking about.
No, I think that was beautiful.
Oh, wow.
I think that was beautiful. I think we end with that. Thank you. That was really sweet. I love that. The prioritize and protect is our last message. It's contentment, happiness, and acceptance is a choice. Make it a priority for the day and protect it. And then I wouldn't choose this, but we can't unchoose this. And we still have a life to lead. That's it.
Thank you so much.
Thank you.
Alicia and Nick, thank you so much for sharing your wonderful story. And it just means so much to us just to hear your personal experience, and we really appreciate it. That was wonderful. So guys, now we are going to have a panel discussion. I'd love to invite Marlene Perdan to the stage also, who is a care partner to her husband with Parkinson's. Marlene, welcome up. All right. Thank you so much, guys, for coming up here. And we're going to take the next 15 minutes or so just to kind of talk about some of the points that came up during our meetings. And during the planning of this Care Partner Summit, we got together and we said, what is really important for you guys to share with the attendees of today's program? So just kind of bringing up some of those points. One of the points that came up was that it's really important for the people or for as your partnership to do things with each other and also do things separately. So Marlene, can you speak to that first, please? Thank you.
Hello, does that sound good? I am very happy to be here. Yes, so I'm thinking about that question. It really is important to do things together. Bill's been diagnosed with Parkinson's since 2009. So we've been on this journey about 13 years. And what I found was he's not working and I've recently not working. So we are home together a lot. And so it's important that we do things together that aren't just Parkinson's and work related, because we were spending so much time doing things like, worrying about medication, doctor's appointments, therapy appointments, and forgetting to do the fun things. And what we found out that worked really well is to do something new, because we were trying to do the old things that he struggles with, and it wasn't fun anymore. So we took a Parkinson's tap dancing class, and that was, I don't know how well he liked it, but we had fun together, and we both, fumbled through it. And I was sharing earlier that Bill really likes to paint since Parkinson's, and he took a painting class, and that's something we can do together and separately, but together. And so now we're creating new memories and having fun. And so it's just been a really good thing. On the other hand, it's really important to spend time apart, because I was getting so resentful that I was missing things that I like to do, like reading and crafts, and because he was always around. So I think it's important to try to carve out time. And I really notice when I'm not getting that time off. And then the other thing I realized too, when we're apart, I think as care partners, at least I do this, we tend to think that we're the only ones that can do it. If I'm not there, is he going to be okay? If I'm not there, is someone else going to be able to help him? And when you're apart, then you start to realize that, yeah, he'll be okay. He can either handle it, or if he needs help, we'll get him help. This weekend, he's at home, his brother's with him, and they're doing okay. They called a couple of times today looking for things, but they're okay. And I think that gives you more confidence, and it allows you to have time to think that it's okay to spend time doing the things I need to do and like to do, because we're separate people.
Thank you, Marlene. And Alicia, Nick, would you like to add to that?
Oh, no, I have a mic. Yeah. Yeah. I love the doing new things. That's been my piece about it too, is, finding new things to do together, saying yes to a lot of things, even though I don't want to do them. But sometimes he'll come up with a fun idea. I'm like, okay, let's do it. And I think that's a great way to do things together. But, we have always been pretty independent people. We've always really admired each other's goals and dreams separate from each other also. We know when that rubber band gets stretched too tight, we got to come back together, but we are definitely, we don't even share the same last name. So, I mean, it's just, they're the independence we do. I value that. And I hope that you do too, that away from me.
Yeah. And I can't think of anything that's probably more important in a marriage and in some kind of, situation like this than balance, because if it's tipped one way or the other, and it's that you can be in denial just like anything else. And I think eventually it catches up with you, and it's kind of about designing a scenario that you can maintain, but also manipulate to each other's benefit as it goes along. Be like, hey, I really miss golfing, which I don't, but if I did, I would miss it if I wasn't able to do it. And, and to be able to do that and to be able to have that honest conversation of, this is what I need. I mean, she's, as she becomes a doctor, and I'm not really thrilled about having to call you Dr. Peters, right? Yeah. We'll have that talk later.
Okay.
But, she's in countless meetings and countless committees. And as much as I would love her home now that our 19-year-old daughter has moved out, I also see the benefit. That's what, people fill this person's bucket. I'm a little more to myself. Put me in the garage, put me in the backyard with the dogs. I'm completely content. And just acknowledging that they're both right.
Thank you. Another theme that came up was care partners should be honest with family and friends and let people know how they really are doing. So, Marlene, would you like to speak to that?
Yes, I realized early on, we tend to, or at least I do, when people ask how we're doing, we say, oh, we're doing good. And you want to focus on the positive and what is working, and that's important. But at the same time, I found out that people just a lot of people don't understand all of the issues that go with Parkinson's, and we're all on a different journey. So we just need to be honest about it. I found out that once Bill started having more cognitive issues and memory issues and a lot of trouble with executive functioning, I just started telling his family just like one thing. Like they'd say, oh, he's moving really well. And I'm like, he is, but he's being really forgetful, or, he's really struggles to use his phone. So if you don't get him, call me. And it was like an eye opener. They're like, we didn't realize that. We didn't know. And people want to help you, and they want to be encouraging, and they won't know how to do that if you're not honest about it. If you don't really tell them, this is what's going on. This is why we're struggling, because we look good, we clean up good. We go to, when we go out or something, he's ready. He took a nap, took a shower, we look good. And so, not that you have to share everything with everyone. That's up to you and your comfort level. But I think just letting people into your world a little bit, it really does help to let them know how to help you. And it makes you more comfortable, at least for me.
I can really empathize with that. And I just want to say too, that, here we are, I'm the care provider of this. I mean, like, she's amazing. She has so many abilities. And the reason I try to draw where I draw all my strength and all my importance is from people that I've seen and witnessed and met that are on a path a little further down the road. That's what gives me the energy and the importance to get things as lined up now. And, so that when we're challenged with the things that you're challenged with, I feel like I might be able to handle it better than if I just waited. I get called, when my mom calls me and she says, how are you? And I just want to hang up the phone, because she's not watching. Because it's on the internet, but I feel like, we're doing great. We're doing great. And it's like, and I know that, people would do whatever they have to do to help, but right now we got it handled. We're good. But it just kind of, so it's that balance of understanding people's global idea of what it is and understanding where you're at. And I think we're doing great. And it's from the strength and support from the experience that we've seen through the Parkinson's Foundation, because we need to be ready. Oh, sorry, you got your own.
No, and building on that, what would you say to others when they offer help?
Well, earlier, I think you tend to say, no, I got it. We're good. But as we went on this journey, I realized I don't have it. I need help. But for me, I found out if I have this list in my head, once I started to make a list of what I really needed help with, and then when people say, what do you need? I'm ready. And I think that's important. One of the things, and I only have like 2 or 3 things, but they're the 2 or 3 things that help the most. My go-to is, especially when Bill's friends ask, what can we do for you? It's like, take him to lunch. Because then I get a couple hours away and he got away from me, which is a good thing, right? And he gets fun and it's easy. I mean, it depends, how much help you need, but that's not something that's hard. And people are like, oh, I could do that. I can take him to lunch. I can go out to lunch with him. He's not driving right now. So him meeting friends is harder. So things like that, if you're ready, so just take a really good look at what it is that could be most helpful for you. And then just, again, be honest with somebody. But I think doesn't mean you have to let them into your whole world, or doesn't mean you have to ask for everything. But little things really do mean a lot, add up, help a lot.
Okay.
I love that. Thank you for sharing that. And another theme that came up, which I thought was really important, was take time to focus on the original relationship prior to the caregiving and the diagnosis. So Nick, I'll let you speak to that first.
Well, we've had quite a rich history, her and I think everybody individually has their unique story. And I think whatever you can do to preserve. And I think that's I was trying to think like, kind of what are the P's of Parkinson's, and like preserve is definitely one. Preserve what you take as much with you, like in any life, just take that with you. So whatever makes you uniquely you as a couple, you and the things that maybe came easy in the beginning, as we get older and get into routines, a lot of part of routines is leaving other things out. Well, maybe you need to actively bring these things along with. And that, I think, really helps. For sure.
Yeah, and
That's a great
thank
point.
God I'm not the same person I was when I was 19. Oh my gosh. But it is growing and changing, I think, is really important. And this is just another change and another thing we need to adapt to. Mm-hmm.
And Marlene, would you like to speak to that?
Yeah, I think it's gotten harder because as the symptoms keep adding up and the intensity over the last 13 years ramp up a little bit, it gets harder and harder. So you lose a little bit perspective on his personality has changed more and more over the years. So it's been harder, but I think it's like just, we've been together too. We'll be over 40 years next year. So, yeah. And so it's hard to remember for anybody, right? How it used to be. But I think one of the things people will say, Bill has a really great sense of humor, and he'll every once in a while come up with a joke and everybody go, he's still Bill. So I try to focus on that type of saying, yep, he's still who, this is what he was 40 years ago and he's still there. So trying to look over the symptoms and get back to that core of what the person, who they really were, what they like, and are they, he's still got the sense of humor. So it's good.
I love that. Thank you. And now we're going to transition to our Q&A portion with our panelists. So we're going to make this really simple. If you have any questions for the panelists, please raise your hand and we will walk to you with our microphone. And just raise your hand, or if you have any comments, please feel free. Here we have one over here.
So my husband has Parkinson's. Our son is 19. I think girls and boys are different. I'm hearing a really different story about how your daughter embraced this. At 19, boys identify more with their fathers, which I've worked hard to try to help maintain. But Steve was diagnosed. It was kind of like, we don't really know what's wrong with you, so we're going to throw cartaleava dope at you and see if it works. Well, if a duck walks, talks, and is a duck, then it worked. He has Parkinson's disease. But however, our son was like 15, 16 when this was all going on. And I was the mom like who kept, oh yeah, I'll admit I'm a helicopter mom, but I knew his friend group, and I know that kids at that age, like they don't handle that well. And Jacob pushed away, and there's not a lot of good resources to go to or draw from for areas for support to help involve. My older son is 25 going on 26. He's much better. Like at some point we're going to make him the POA. We have another adult person in charge right now, but Jacob still to this day, oh God, I hope they're not on the internet. He's better, but he's still not like he calls dad. And I want to preserve that. Like, yeah, call your dad about tools and cars and what do I do? And call me when you're flunking your class. But I don't know how to, like he laughs at some of the things that happened to Steve. And the last 4 years, I've worked hard to try to preserve memories for them when we go on family vacations. It's fishing. I hate fishing, but I go because, it's giving him a memory of his father my husband's a little bit older than you guys are, but not much. So that diagnosis, I want the boys to have these memories of them as, who he is. And hopefully we aren't going to experience a severe decline, but, I struggled with and Jacob is like, I don't want to talk to a counselor. I don't want to talk to a counselor. Mom, don't force me to volunteer for any Parkinson stuff. And I'm on a lot of online support groups, but he's getting better and I think he will get better. But this is a hard thing because more and more people are becoming diagnosed with a Parkinsonian type movement disorder younger, and they have younger children, and there's not really a lot of resources to help us guide them or anything. So maybe I really didn't have a question. Maybe it was just an awareness I'm bringing forward.
No, thank you for sharing that. And my father lived with Parkinson's for 13 years. And so, when he was diagnosed, I was in my late 20s, right? And my first reaction was to put my head in the sand and to avoid it. And then, that's very different, obviously, than a teenager, right? Totally different. But I'm just sharing that example because even as an adult, it was very hard for me to accept that. And then for me, what worked for me was getting my head out of the sand and then reading and educating myself about the disease, right? But again, very, very different than a teenager. So, as far as what I would say was if you guys do connect with other people in the community and maybe there's other teenagers or other kids his age that maybe he could connect with, that might be beneficial. But it sounds like you've tried a bunch of things, and it's probably an evolution of how he copes with it and how he's going to deal with it. But no, thank you so much for sharing that. And if any of you have any comments on that, that would be great.
Listening to that, I can completely empathize and understand that. And with my background and, working with people that lose the ability to do one thing, I can only imagine that, like your son and your husband, they've got that we're talking about preserving. Well, there's a point when that struggle becomes too much and it becomes like the rope gets frayed and now it'd be too much work. My advice, and this is what I've tried with people, that is reinvent that relationship, try something new. She brought up with like painting, something gentle, something that's, easy to do. And maybe if you can just create an opportunity for, father and son to just kind of reinvent their relationship in a way that they can kind of start from ground zero and accept where they're at. And that might be just doing something completely different. And to be honest, we all kind of go through that as our parents' age. I've got a dad that's 83 that can't quite do the things. I took him to a fishing thing that he loved fishing, but just getting him in and out of a boat is tough. So we ended up a lot of times sitting around the pool and eating popsicles. We drove all the way to Key West to sit around a pool and eat popsicles, and he was on cloud 9. And I would rather have been in a fishing boat, but it strengthened our relationship in a way that only popsicles could. So that would be my, just maybe something to try.
We have a son and a daughter, and they handled this very differently. In fact, our son's older, and he was in his 20s when Bill was diagnosed, and he put his head in the sand and just wanted to not even talk about it. And where our daughter was trying to do everything to help. I think getting older, now he's 40, I think getting older helped a little bit. It's just in accepting the whole, accepting the diagnosis and the changes. But I watched him, and I think they just need time to grieve the loss that, there's changes. One of the things that they always did together was play a lot of board games. And my son just recently said, he goes, I've got a closet full of board games. I want to show Dad, but Dad won't know how to play them anymore. And so he struggled with that. That was a real loss for him. That was like a good memory growing up. And so then I think he's trying to find ways, like he just recently said to me, okay, what game could Dad play? And I go, well, he likes that matching solitaire game. He goes, oh, I can do that. I can get that game. And so I think it just takes them time sometimes to, grieve that loss. And then, like you said, find something new that works, and you will. It's just, but it's hard when that, rug gets pulled out from under you and like everything you knew is changed. So, but our experiences, our son and daughter handle it completely different. And I don't know if that's always true, but it was our experience.
Thank you, guys. Great suggestions here. And I'm trying to see if anyone, okay, we have a hand raised over here.
Thank you. I'll still stand up. I wanted to ask Nick about the silverware, because you said that you noticed that your wife was putting her face close to the plate and everything like that. My husband did some of that in the beginning. And right now when he eats, it's like half the food drops in his lap and on the floor and stuff like that. So if you could provide a place for me to be able to go maybe and get some of that to see if it helps him, because I know that notice how he holds his fork. It's not the same. And sometimes he'll ask for a spoon. It's like, can I have a spoon? He'll eat better with a spoon. And sometimes that doesn't work either. So any help with some of that I would greatly appreciate it. And I'm just looking for other ways to involve family. My husband and I were recently married. We've been together forever, but we got married in 2016. And so this was supposed to be our forever journey in traveling and all of that type of stuff. But we've had some challenges along the way since 2016. And I'm looking to try to include and make this family what it should be. And I hear you all talking, and some of the things that you talk about, my husband and his son never did those things. And I'm at a loss for trying to find a way to bring them together. And my daughters tell me, Ma, do you need some help? And I'll say, no. Because I know that if I say yes, my husband is going to say no, because I drive him everywhere he wants to go or the things that he wants to do. And he sings in the choir at church. They allow him to sit down because he can't stand for long periods of time. So he sits. When they have rehearsal, I take him to rehearsal. I said, can you get one of the other guys to bring you home? Or do you want me to come back and get you? His thing, I want you to come back. So sometimes he's not shared some things with some people, and I have, but it's just some of those things that would help if you could provide some information.
Absolutely. Wow. That's I mean, look at all the dynamics just right there. We'd start talking about forks and spoons, and it's all that so quickly. And I mean, just imagine how powerful it is for me to be sitting up next to her with her story. It's overwhelming, just you know, and so I'm pulling so much strength and experience from that. So I really appreciate your story. And so back to that, you know, and again, with my memory issues, but what I can do is when this is done, I'm happy to look up my Amazon thing and tell you exactly what silverware. It basically, one of the things that we've used is as opposed to like the really thin silverware, there is weighted silverware, and it ends up being fancy silverware. So it's not even really like adaptive, but it just kind of, it serves the same purpose. You can get heavy weighted silverware, and I'm happy, as soon as, like I say, I'll look it up to find out what the gram weight is, but it's generally, if you just on Amazon, heavy silverware, you'll get a list. And it really, it's significant. Even for me, I love eating from it. I feel like I'm fancy, like I should be the captain of a ship or something like that. I mean, it's nice. So that, and even like the forks, the spoons, I think are amazing, because that's just really, really helpful. The other tip that I can tell you, and this is something that we use in our adult foster care, where we have people that have severe tremors and severe motor skills that don't allow them to necessarily, if you had a fork and a plate, it would end up everywhere, right? So a lot of times those folks end up being assisted fed when they can, if you make a few adaptions, something to try with your husband to, you know, to help maintain that dignity and that independence is maybe a little bigger. Like we've got one gal that I help that actually, she eats all of her meals out of a mixing bowl. Okay. And a big wide, like soup spoon, and she can shake all she wants and makes it to the mouth. And if anything falls, it falls back into the bowl. And she feels so, you can tell she's so proud because she's not getting it on her clothes, and she's also not being fed. And this is an individual who is doing it herself, or whether it's lasagna or ice cream or, you know, whatever it is, having that, making those little adaptions that they net you, you know. So that's just some of those, and just giving yourself permission to make those choices, you know, for yourself or for other people, is really important. But yeah, so I'll definitely look up my account there and see what exactly we got, so I can send you down that path.
And we can also include a follow-up link to the registrants of today with a link to some adaptive things like that as well that could be helpful. So we'll definitely include that as well. Thank you. All right. Marlene, did you want to? No. You're good. Okay. Well, guys, we'll do one more question over here.
Hello, my name is Maria. I have a father with Parkinson's disease, and I just wanted to thank the other two ladies for speaking, because I can relate to both of your stories in regards to family dynamics. My brother is older than me, and it's a similar situation. So I agree with both of you. If there are any resources to help us there, I'd appreciate that. What I wanted to ask the panelists, the fine couple that spoke, is I really admire your relationship and how open and, quite frankly, healthy your conversational dynamics have been. How did you get to that point? Did you use any outside resources like a couples therapist that, you know, focuses on one of the spouses having a terminal illness? Did you reach out to support groups? Was it just, you know, your own individual personalities and experiences? I think it's great that you have the relationship that you do, and you've been able to come to the point that you have come to in this point of your journey. I only wish that for everyone else. I can see the challenges with my own parents, and I understand a lot of it is individual personality, but I was curious to learn more about how you came to be how you are now.
Oh boy. I don't know, 31 years was one thing I thought of too, I you know, we go to dark places living with Parkinson's, and I remember I was watching a movie that was about Parkinson's, and this this guy walked up and he said, how far along is, and he's like stage 1, whatever. And then they're like, oh, and it was about marriage, and it was like, leave and get yourself a different wife. And all, it was awful. Like I just was like, oh, and I called them and I said, oh my gosh, what did you sign up for? Are you okay? So he was working at the time, and he said, well, what would you tell me? And I said, I would just be there for you. It's all good. And he's like, yeah, that's the answer. And we had a lot of conversations about this, what you're asking prior to this, which I'm so grateful that we've had this opportunity, because we've had a lot of great conversations. And the one thing I said, we're in a different place in this journey. And I've had a lot of friends who have had really challenging relationships with, as a care partner in their marriage. And I said, what do we do with that? And I think you said to start where you're at, right? You don't remember? It's like, maybe that's the part that works, that he doesn't remember anything. And then we can, it's Groundhog Day every day with him. I don't know. Yeah. Maybe that's why we're, but and how we got here, there was therapy. Absolutely. Absolutely. Raising a teenager is tough. I feel like we persevered through that. That was a huge piece. But I think I would say the tools we learned in therapy was quite wonderful. Yeah, please.
Yeah, I just wanted to watch you struggle for a while.
Yeah.
Yeah. So to answer your question very directly, yes, we went through a family therapy. How many years ago? Handful of years ago.
Yeah.
So in what that therapy, because we were struggling in our marriage, just with the habits, of just getting comfortable being annoyed with each other, and then having the dynamics of having a daughter and all the things that go along with that. We went through something that was ended up being, I was a little opposed to it in the beginning, but it ended up being like one of the biggest lights that have been turned on in my life ever, mainly because I was reaffirmed and told all the things that I knew were really there. The accepting an alternate reality, not that everything revolves around you or that everything reacts to you, but that we're all planets bouncing around this, and that her hopes, dreams, wants, and needs are equally as important as mine, as hers, as yours. And to find a way to make that all blend. So to really kind of take a humble look and to value that, to learn to value that. And actually, it's kind of back to what I said before about giving yourself permission to kind of be vulnerable and accept the fact that, okay, we handle stress differently. That doesn't mean that even if in my mind, I feel like I'm handling it better, it's not. It's just different. And together we can work that out. So it was kind of like a, we kind of, so that really helped. And so this wasn't just some magical relationship. This is, 30 years of hard work, and those resources are out there. They are, and I cannot, the therapy that we went through was DBT. If anybody's ever heard of that, it was for family therapy, and that really breaks down all of your faults, and it's really, really eye-opening and humbling.
Say something. I just say real quick, we as a couple went through couples therapy both prior to the diagnosis over the years and after, and it did help to give us some perspective on how to deal with the diagnosis. But one of the things that's happening lately, Bill will get frustrated and say, I don't know how you're handling all this, and I can't, he'll get upset and just say, you should just leave and go off into that type of, why are you still here? And I can't believe you're still helping me putting up with all this. And I just looked at him and I said, well, what would you do if you were me? What would you do if it was the other way? And he knows the answer. He would stay around and he would work through it. So I think you just have to remember, it's feels like you're putting the person through such a burden, or they're putting the burden on you. But you're in a relationship and you want to, you're going to be there. So it's okay to feel that way, to feel like, yeah, I want to leave, but, work through it. But counseling did help us too.
Mhm. Thank you guys for putting that so eloquently. And that concludes our Q&A for this panel discussion. And I just want to thank the three of you, Alicia, Nick, and Marlene, for sharing your experience. And we just all thank you here today. So thank you very much.
Hi, everyone. Firstly, I just want to thank each of you for taking the time to attend the Parkinson's Foundation's Care Partner Summits that are streaming and in person around the country. So thank you for showing up for yourselves. I'm Krista Ellis with the Parkinson's Foundation, and I am so grateful to be able to join you to share some tips and techniques on how to manage stress, which is also suggestive of self-care. First things first, have you taken a deep breath today? Let's do one together. Taking a breath in and letting that breath go. That's better. So we're going to start our conversation today on stress so that we can better understand how stress affects our bodies and our mind. Where there are so many stressors in our daily lives, like getting to the doctor's office, running errands, making that phone call, traffic, taking medicine, our family, our friendships, our relationships, and so much more, those stressors can be intensified for those who are living with or caring for someone with Parkinson's disease. I always love to define topics and words that are around the sessions that I cultivate. So let's define what stress is. Stress is our body's response to pressure. Many different situations, experience, or life events can cause stress. Stress is often triggered when we experience something unexpected, something new, something we don't like, or something that threatens our sense of self, or that we feel we have little control over. Our response to stress is different for everyone. Our ability to manage or deal or cope with stress can depend on our genetics, early life events, social skills and circumstances, and of course, our environment. Now, I'm going to say something that you just might roll your eyes to. Managing and preventing stressful situations can be supported by taking care of yourself. What the field of psychology has discovered is that when we prioritize self-care, we are more adaptable and likely to respond in a healthy way to those stressful situations. That makes us more resilient. Now, I'm borrowing from positive psychologist and resiliency expert, Dr. Maria Sirois. We already know that self-care matters, right? It's not the issue. The issue is actually doing the things that promotes or elevates or encourages our own self-care. Knowing that self-care is important is one thing, but actually prioritizing our self-care is what we are concerned with today. And as caregivers, it's much easier for us to prioritize the needs of someone else versus the needs of ourselves. Self-care can be one of the hardest things that care partners offer themselves. But when we prioritize our self-care, we can reduce stress. So now we're going to do an exercise that we call mindful pausing. And during your moments of pause, we'll be practicing mindful breathing. You can think of a mindful pause as a moment to check in, just a few minutes to connect to how you're breathing, how you're feeling, noticing your heartbeat, and notice where we're at mentally. And during our pause, I'll ask you to focus on the rhythm of your breathing. The rise and the fall of your chest, the inflation of your belly. So when we have restricted breathing, we only have shallow breathing, which is like we fill the lungs and the upper collarbones and below, but we don't let the breath come down into your belly. So relax your belly as you're breathing. You can notice the sensation of air coming in and out of your nostrils, just taking a few deep breaths. Now, during your time, like the mind does, It will likely wander to things in the past, things that may be going on today, or we're worrying about the future. It's okay. That is the practice of mindful meditation. As soon as you notice that you're distracted by a thought, a sound, a sensation, I'll just invite you to notice that you're distracted. That's interesting. And come back to breathing. Come back to the rhythm of your breath, how it feels. Shall we try it? All right. So let's just start by finding a seat that's comfortable for you. If you're tuning in at home, you could be lying down. You could be leaning on the table, whatever is good for you. Hands can be placed where it feels good, on the lap, on the hips. I'm going to place my hands on my heart. This really helps me stay focused and connected to the rising and the falling of my breath. So feel free to join me if you'd like. And now just close your eyes. Take a deep breath in through the nose. Open the mouth and let that breath out. And again, deep breath in through the nose. And out through the mouth. Good, and one more. Slowly breath in. And breath out. Good. And just continue breathing. So your rate of breath will be different from mine, will be different from that of your neighbors. Breathing in. And breathing out. Noticing how your chest rises and falls with the breath in and the breath out. Focusing on the rhythm of your breathing. And if you become distracted, that's okay. Just notice. This is the practice. This is exercise of the mind, exercise of the brain. Notice that you're distracted. And bring your focus back to the sensation of your breathing. Moments of pause just for you. And now I'll be quiet for a moment, a couple seconds, so that you may practice. Breathing in and breathing out. And let's take one more together. Breathing in and out. And fluttering your eyes open if you aren't already. And releasing your hands if you've had them on your chest, or just a little gentle wake up, maybe a shake of the shoulders, a wiggle of the toes, a roll of the ankles. Moving fingers. Notice how you feel. Notice how you feel. There are many reasons to practice mindful meditation. Meditation has been researched for many, many years, and science tells us that stress reduction is one of the most common reasons why people try meditation. Meditation promotes emotional health. It enhances your self-awareness. It lengthens our attention span, and it can generate kindness towards ourselves and towards others. Mindful meditation trains our minds to notice that we're distracted by thoughts, feelings, sounds, sensations. And when we start to notice those distractions, we are strengthening the muscle of our brains to refocus our attention, to refocus where we spend our valuable time and valuable energy. We want to be investing our energy, our attention more and more into the domain of self-care. Why? Self-care is the #1 preventer of burnout. The last thing any one of us wants to experience when we're taking care of someone we love or care for is to be so exhausted that we feel like we can't show up. So we practice mindfulness, which will prioritize self-care, which will prevent burning. The other reason we practice self-care is because we matter. No matter who you are, no matter how important other people's lives are or how significant they are to us, we matter. You matter. And in that prioritizing of our own mattering, we strengthen our relationship with ourselves. And when our relationship with ourselves is strong, our relationship with others strengthens. We can shape our day by asking ourselves this question each day while you're drinking coffee or tea, as we rise from the bed, brushing your teeth, taking our morning walk, watching our morning show. What can I do today that might strengthen me, calm me, or inspire me? We shape our day in these directions to either feel stronger, calmer, or inspired. So I'll ask you right now, what might you do today that could strengthen you, calm you, or inspire you? The good news is most of us have answers to these questions. Some examples that I've received from the Parkinson's community during our Mindfulness Mondays, people say going for a walk, practicing yoga, being in nature, taking a bath, playing the violin, hugging or petting my dog or my cat, going for a swim, taking deep breaths, making a scrumptious meal. We know what helps us. We know what strengthens us, calms us, or inspires us. We know the things that make us feel stronger, calmer, or inspired. The difference between us are those folks who are actually doing the things that help. So again, what might you do today that could strengthen you, calm you, or inspire you? If you would like to learn more about mindful meditation, I'd like to invite you to join me at the Parkinson's Foundation for our Mindfulness Mondays program. Each Monday, we lead our community of people with Parkinson's, care partners, and other allied health professionals through a mindful meditation practice and address a variety of topics and techniques that can help reduce stress. It's a great way to commit to 30 minutes of self-care each week. You can learn more about our PD Health at Home Mindfulness Monday program at parkinson.org/PD. I thank you all in taking this time for yourselves. And I leave you with that question. What can I do today that might strengthen me, calm me, or inspire me? Be well, everyone, and enjoy the rest of Care Partner Summit.
Okay. Dr. Eichenseer is Assistant Professor of Neurology at the Medical College of Wisconsin. She specializes in the care of patients with Parkinson's disease and other movement disorders. She is originally from the Northwest Indiana region. She completed her undergraduate education and medical school at Indiana University. She went on to complete her residency and fellowship in movement disorders at Rush University in Chicago. She joined the faculty at the Medical College of Wisconsin in 2013. She currently practices in New Berlin and Menominee Falls. And thank you for joining us today, Dr. Eichenseer. You can come up to the stage.
Okay, now can everyone hear me? Okay, great. Thank you so much for that introduction and for inviting me here today to speak about cognitive change in Parkinson's disease.
Yeah, keep going.
There we go. Okay, great. So I have no disclosures to report today. The objectives of today's discussion are outlined here. So how can thinking processes be impacted by Parkinson's disease? how you as a care partner may feel or what emotions you may experience as your loved one is navigating this process, and how to provide support to your loved one using different tools and strategies to assist with thinking changes that may be occurring. Cognitive impairment in Parkinson's disease exists on a continuum of severity. So on one side, we have mild cognitive changes where there's a slight change from the baseline, either observed by the person themselves with Parkinson's disease or family members. At this point, the cognitive changes aren't really affecting their day-to-day activities. On the other side of the spectrum, we have more severe cognitive impairment, when these cognitive changes affect one's ability to maintain functional independence in society. The prevalence of cognitive impairment in Parkinson's disease increases with duration of the disease. So in newly diagnosed patients, mild cognitive changes may be present in 10 to 35% of people. Again, very early on in the disease, we wouldn't expect cognitive changes to significantly affect one's ability to function in society. If that is the case, or if there are more severe cognitive changes, then we're likely dealing with something other than regular Parkinson's disease. As the disease advances and as cognitive symptoms become more pronounced, a dementia may be present in up to 30 to 40% of people with Parkinson's disease. When an individual reports cognitive dysfunction, we as healthcare providers must figure out where along the spectrum that person is. In making that decision, we consider how these cognitive changes are affecting what are called the instrumental activities of daily living, which I have outlined here on this slide. These are more complex tasks that are required for an individual to function independently in society. These activities include cooking. Can an individual meal plan, gather the ingredients, make a list, get to the grocery store, and then bring all these ingredients together to make a meal? Maintain the house as well as household chores, such as doing the laundry, taking medication as prescribed and on time, managing personal finances, paying bills on time and ensuring those bills are being paid accurately, balancing the checkbook, etc. Effective communication. Is the individual able to receive and make calls in an effective manner? And managing transportation, whether that be independent driving or managing public transportation, such as setting up medical transport shuttles, ride shares, public transportation such as the bus, etc. When cognitive dysfunction affects one's ability to carry out these tasks, then we're dealing with more of a dementia. So in summary, with mild cognitive impairment, this is a cognitive change that's noted either by the individual or family that's different from their baseline. But despite these cognitive changes, they're still able to function independently. A dementia, on the other hand, is more significant cognitive impairment in at least two domains. So when we speak about domains, there are multiple things that, multiple processes that affects one's ability to think and recall things, such as attention, concentration, executive function. And in dementia, we see that at least two of these areas are affected. We'll talk about that more in the coming slide. In people with dementia, the cognitive impairment is severe to the point where it interferes with their ability to function independently in society. So on this slide, I just wanted to go through different types of cognitive problems that may be seen in the setting of Parkinson's disease. You may notice that your loved one has difficulty with attention or concentration, difficulty with planning and organizing or multitasking. So if you have a busy day ahead of you with multiple different tasks that need to get accomplished, how are we going to go from A to B to C? And how will we complete one task before moving on to another task? difficulty with visual and spatial abilities, and this really translates into safe driving. So are people getting lost in familiar locations? Do we understand where that car is in relation to where we are before turning into the intersection? Difficulty communicating or word finding difficulty. You may find that your loved one tends to want to pull back or pull away from social situations and not participate as much in conversations, either when multiple people are talking or it's a more complicated conversation. It takes longer to find the words and pull that thought process together, and sometimes the conversation has moved on. Difficulty problem solving. So in Parkinson's disease, we have difficulty moving from one step to the next step to the next step. So when you talk to your loved one and say, these are the 3 things that you need to do to accomplish your end goal, some of those thoughts can get a little bit messed up. So it's important to kind of provide one instruction at a time, let your loved one complete that, and then move on to the next task. Impaired judgment and decision-making. Something I hear all the time in the clinic is, well, I know I needed the walker, but it was a short distance to the kitchen counter, so I left it and just went to the counter. And oftentimes that results in falls. So making sure that we have good insight and judgment and decision-making. And recall difficulties. So difficulty recalling an event or details of an event can be challenging in Parkinson's. Other neuropsychiatric symptoms that may be present include hallucinations and delusions, both of which we'll speak more about in the coming slides, mood disorders, as well as sleep disorders. I've included mood disorders and sleep disorders on this slide because these are symptoms that can occur in people with Parkinson's disease with or without cognitive problems. Pseudodementia is a term that is sometimes used to describe an individual that has profound depression that leads them to appear as if they have dementia, even if they do not. So this is a very important discussion to have with your loved one. How are they doing in terms of their mood? And also involve your healthcare team in these discussions so any mood symptoms can be adequately treated. Similarly, in Parkinson's disease, we know that sleep can be affected for a myriad of reasons. I won't get into this today because this is beyond the scope of today's lecture. But when sleep is dysregulated or when we're not getting enough sleep overnight, that certainly can affect cognitive function during the day. So finding strategies, again, talking to your healthcare team about strategies that your loved one can do to optimize their sleep overnight and improve both their cognitive and motor function the following day. So what are hallucinations? Hallucinations occur when an individual is completely awake. So that's an important thing to acknowledge. It's not dreaming overnight. It's not vivid dreams that can occur commonly in the setting of Parkinson's disease. So this is when an individual is completely awake and they're seeing things or hearing things in the room that aren't really there. Visual hallucinations are the most common in Parkinson's disease and can occur in up to 40 to 50% of people with Parkinson's disease, with or without dementia. So medications can certainly contribute to hallucinations. When hallucinations are new in onset and relatively abrupt in onset, we're always concerned or looking for a potential infection. So that's also something to be aware of. Most visual hallucinations in Parkinson's disease are complex. So people will see animals in the room or children in the room. And sometimes these images can be very frightening to your loved one, and sometimes they aren't too bothered by them. So it's important to also ascertain that bit of history. How bothersome are these images? In addition to visual hallucinations, people can also experience auditory hallucinations where they're hearing things. So they can hear music, they can hear voices, tactile hallucinations where they're feeling things on their body, and olfactory hallucinations where they're smelling things. Again, these are less commonly associated with Parkinson's disease, but certainly can occur in that context. Hallucinations in general can be associated with cognitive dysfunction, but as I mentioned before, may also be medication related. So it's important that you and your loved one and your healthcare provider review the medications that your loved one is on and make sure that these are optimized to minimize any potential side effects of hallucinations. If delusions occur, typically we see this more in advanced Parkinson's disease. And delusions are false beliefs that are not based on reality or fact. So in Parkinson's disease, sometimes people will think there are other people or extra people living in the house that do not belong to as part of the family. Concerns about infidelity or someone stealing or trying to hurt that person. So both hallucinations and delusions can be very disturbing, obviously, for your loved one and for you as a care partner. It's important to acknowledge what your loved one is seeing or feeling or hearing, but then also provide reassurance that your loved one is safe. So why exactly do cognitive problems happen in Parkinson's disease? Well, we don't fully understand that, but we think that cognitive changes occur as Lewy bodies, which are the pathologic hallmark of Parkinson's disease. The pointer is working, but it's pictured right here. So when those Lewy bodies spread to areas of the brain that control attention, thinking, and memory, that's when we see cognitive symptoms occur. So Lewy bodies are basically abnormal protein depositions in the brain that are made up of a protein called alpha-synuclein. Initially, Lewy bodies are present primarily in the olfactory system, as you see here in this first image, and in the lower part of the brainstem. So at this stage, we are not detecting motor symptoms of Parkinson's disease. We're not seeing tremor, slowness, rigidity, or stiffness. At this stage, people may experience problems with their sense of smell. They also may experience what are termed autonomic symptoms. So symptoms that are controlled or processes that are controlled by our autonomic nervous system, such as bowel function, so constipation, urinary symptoms. Some people may experience lightheadedness or dizziness when they stand up. As the Lewy bodies spread higher up in the brainstem into the region called the midbrain here, this is when we start to see motor symptoms of Parkinson's disease. So the tremor, the stiffness, the coordination issues. And then as these Lewy bodies spread to the cortex and the subcortical areas, at this stage is when we're potentially seeing cognitive side effects, or cognitive effects, I should say. And the reason I say potential is that there's some discrepancy in the literature about these cortical Lewy bodies. So in some people with Parkinson's disease dementia, they have these cortical Lewy bodies present when we take a pathologic specimen of the brain. But sometimes those Lewy bodies aren't there. And in some instances, people with either normal cognitive function or mild cognitive impairment may have these Lewy bodies present in the cortex. So this is just one piece of the puzzle. We really need to learn more about why and how cognitive changes occur in the setting of Parkinson's disease. So how do you support your loved one if and when these cognitive changes may occur? So in someone with difficulty with attention or concentration, it's very important to minimize distractions. So oftentimes what I hear in the clinic when I watch someone walk down the hallway is, oh my goodness, he or she never does this well at home. Well, it's because they're paying attention. They're concentrating on their walking because they know that their healthcare provider is watching them. So at home, trying to minimize distractions, avoid talking to your loved one as he or she is walking through the room. During meals, try and minimize conversation, having the television off so your loved one can concentrate on chewing and swallowing safely. And similarly with discussions, making sure that you're trying to minimize any external stimuli. The TV's not on, your loved one isn't reading the newspaper. All of these things take away the attention from the conversation that's being had.
Difficulty with planning and organizing. It's very, very, very important to keep a consistent daily routine. Your loved one will do better with that because he or she will know what to expect from day to day. If you do have a busy day or a lot of tasks to accomplish, it's important to make lists so that your loved one can see everything that needs to be done for the day and maybe can even cross things off as they are accomplished. And also maintaining a calendar with your loved one so that he or she can see what events or appointments are upcoming and can kind of take ownership of those rather than relying on you to say, okay, it's time to get ready, for the appointment. Difficulty with visual and spatial abilities. So I touched on this before. This can translate to concerns with driving safety. So oftentimes what I recommend is for the care partner to ride along as a passenger in the car and just make some observations. Is your loved one tending to stay in the middle of the lane? Are we tending to veer to the side? Is your loved one, ensuring there's enough space before turning out into the intersection? If you have concerns about driving, this is definitely something you should talk to your healthcare team about. At Freighter, we offer an occupational therapy driving assessment. So the decision doesn't rest on you as a care partner. It doesn't rest on the healthcare team, healthcare provider. It's a third party that's doing a standardized assessment of things that affect driving, cognitive function, visuospatial function, reaction time, and then making recommendations based on that. So it takes the onus off of you as making that big decision about, are you safe to drive or not? Difficulty communicating or finding words. It's very important. Oftentimes we're kind of rushing through the day, trying to get through all of our tasks, and we're probably all a little bit guilty of not being patient enough. I know I can say that with my children. I'm not patient enough. So make sure that you try to be patient and allow extra time for your loved one to communicate. That will allow them to participate more in the conversation rather than just peeling back and observing. As I mentioned before, with the problem-solving issues that may be present in Parkinson's, it's important to provide simple instructions and do this one by one. So provide one instruction, let your loved one complete that task, and then move on to the next instruction. If you're giving a series of steps or a list of steps, he or she will not be able to process through all of those. Impaired judgment and decision-making. So obviously it's very important to ensure the safety of your loved one, making sure that even if they're just crossing the room to the counter, that their walker is with them. In terms of decision-making, it's also difficult for Parkinson's patients to answer open-ended questions. So if you say to your loved one, what do you want for dinner? This might sound simple to us, but it can actually be very difficult for someone with Parkinson's disease to process through all these options. So it's easier if you say, do you want this or this for dinner? Then they're able to have more of a say, and it's a little bit easier for them to come to that conclusion. Memory loss. Very important here is to ensure that your loved one and you as a family have a system for safe medication administration. So as you all know, medications can become very complicated in Parkinson's disease. So people can be on multiple medications, multiple dosing times during the day. And when those doses get too close together, or if we're accidentally doubling up on doses, that can cause some very serious side effects. So it's very important to make sure that you have a system in place to ensure this is safe, but still allow your loved one to participate as much as he or she can, but with still some oversight by you. In terms of recall difficulties, it's as opposed to Alzheimer's type of memory loss, which we'll talk about in the coming slide. In people with Parkinson's disease, if they're trying to remember a detail from an event or something else, providing a hint or a clue typically will allow them to jog their memory and to recall that. So that's a nice little clue to just help them out without the loved one having to say, oh, well, this is what you meant, or completing the thought for your loved one. So I'll touch just briefly on treatment of cognitive impairment. We have both non-pharmacologic as well as pharmacologic ways to address these cognitive changes that may be observed in Parkinson's disease. Non-pharmacologic measures basically mean ensuring a healthy lifestyle. So making sure that your loved one is getting enough exercise, that they're having a balanced diet, and that they're sleeping well at night. It's also very important to do mind stimulating activities. This is something I stress a lot in my clinic. Doing crossword puzzles, Sudoku, card games, reading books, all of these help to keep the mind fresh. So those are very important things to do. We also have medications available to treat cognitive problems in the setting of Parkinson's disease. One such class of medications are termed the cholinesterase inhibitors. And basically what these do is decrease the breakdown of a neurotransmitter that's involved in this process. And clinical studies have shown a mild to moderate benefit in Parkinson's related memory problems. And here on this slide, I have 3 different cholinesterase inhibitors: rivastigmine, donepezil, and galantamine. Oftentimes, we typically will do a 3 to 6 month trial to see if these medications are effective. So is family noticing an improvement in home? Are we seeing improvement in the clinic and the cognitive function? If not, then we may take people off of these medications if they don't seem to be beneficial. Side effects of these medications, nausea and GI symptoms can be a common side effect, can also decrease your appetite and cause weight loss. So that's one we're very aware of in Parkinson's disease, particularly as the disease advances. People can struggle with weight loss for various reasons, whether it be decreased appetite, swallowing difficulties, chronic constipation, etc. So this is something that we keep a very close eye on when we start people on these medicines. Another medication is memantine, which also has been shown to be beneficial in the setting of Parkinson's disease related cognitive impairment. The one caution with this medication in people with hallucinations, there have been reports that sometimes memantine can make those hallucinations a little bit more pronounced. Not in everyone. I have a lot of people on memantine that never have problems like that. I should also include that cholinesterase inhibitors, as well as memantine, do help to reduce hallucinations. So that's an added benefit of these medications. In addition to improving memory, they can also help to reduce hallucinations when they're bothersome or troublesome to the individual. If these medications alone aren't effective in reducing hallucinations, then sometimes we consider medications in the category called antipsychotic medications. And these medications are used to reduce very troublesome or disturbing hallucinations and delusions that may occur in the setting of Parkinson's disease. I've listed a few here on the slides. There are many more that I didn't include here. I think the important thing to note here and the important discussion that I always have in clinic is, well, how bothersome are these hallucinations to the individual that is experiencing them? So as a care partner, often these are very distressing. You know, you think, well, oh my gosh, he or she is seeing this. It must be horrible. But when we get in clinic and talk about this, there are times, a lot of times actually, where the person who's experiencing the hallucination isn't too bothered by it. He or she recognizes that it's not a true image that they're seeing. And in that instance, then we don't use these medications because there are risks that come along with them. So in people with hallucinations or delusions related to Parkinson's dementia, they are at an increased risk of stroke, heart attack, and death with this class of medications. So we really have to weigh the risks and benefits of whether to start these medications. So what is your role as a care partner? When severe cognitive dysfunction may surpass the motor symptoms as a major cause of disability and mortality in Parkinson's disease. As a result, care partners can suffer significant stress associated with this cognitive impairment. It's very important to optimize support for you as a care partner, and ultimately that will allow you to provide better care for your loved one. This was a list that I adapted from the Parkinson's Foundation Guide for Caring and Coping, which is a very wonderful resource. So what are the 7 needs of a care partner? The first one is education. Educate yourself about Parkinson's disease and cognitive impairment, so you're comfortable with the symptoms and know what to look for. Your healthcare team is obviously also here to assist with that. Know what medical, financial, and care decisions need to be made. Have open discussions about this and have these early on, and involve your family members so that everyone is on the same page. Manage your time effectively. Recognize the importance of taking care of yourself. This is something I stress a lot in my clinic. So you as a primary caregiver, if something happens to you, or if you get sick, then who's going to take care of your loved one? So it's very important to focus on your health. Honor and protect your relationship with your loved one. Identify your support team and let them know who they are so they're available if and when you need them. And also know what community resources are available for you. So in terms of education, the Parkinson's Foundation has a wonderful list of symptoms, both motor and non-motor symptoms that can occur in the setting of Parkinson's disease. And I've included the website here. Again, learn about what available treatments are out there in terms of lifestyle modification, medications, etc., and know what resources are available to you, both in the community as well as through your healthcare system or healthcare team. As a care partner, it's important to know what medical, financial, and care decisions have been made and what decisions still need to be made. Many of you are probably familiar with advanced care planning. For your healthcare directive, you can state your wishes about future healthcare treatment and designate a person to represent your wishes in the event that you become incapable of doing that or choose to delegate decision-making. That person is called your healthcare power of attorney. So these are very difficult discussions to have, but I really encourage my families to have these discussions early on and involve the entire family. So if and when we get to this point, everyone is on the same page and in the interest of your loved one. Time management. Make daily, weekly lists of things to do, but make sure these lists are manageable and realistic. As I mentioned before, stick to a routine. Your loved one will do better if you do that. Prioritize. So try and get your first task or your most difficult task first, and then move from there. Delegate, delegate, delegate. You can't do everything on your own. So make sure you're reaching out to, friends, family members, church members, know who your support group is and let them know when you need help. And this last point is really important. Take a break. We're all human and we all need breaks. Self-care, health, and respite. So again, it's very important to maintain your own health. You need to build in that quality time for yourself and protect it. So the comment earlier about how can someone help? Well, they can take my loved one out to lunch. That's a wonderful idea. It provides some time away for both of you, so that you as a care partner can do what you need to do. You can exercise, you could take a nap, you can socialize with friends, and that also provides socialization outside of the house for your loved one, which also helps them. Make sure that you're keeping your own medical appointments. So often in the clinic, I hear, well, I couldn't make my doctor's appointment, or so much we forego to prioritize our loved one's health. But we also have to remember to take care of ourselves. And when needed, respite is available. That's short-term help for primary caregivers. And that can be present in multiple different ways. Day programs during the day that can be offered through your county. If you're taking a short trip, respite care is available at certain places. We talked a little bit about this earlier. So it's really important to protect and honor your relationship with your loved one. So much of our day-to-day, even without Parkinson's disease, can be so busy that we lose sight of our relationships. So it's important to take a step back and acknowledge that and express your emotions, whether they be good or bad emotions. If we don't express those bad emotions and hold them in, those eventually transform into resentment. And that will show through your care that you provide. So it's really important to be open with your loved one about the ups and the downs. Develop your coping skills. So again, allow yourself to feel sad and frustrated. These are normal feelings that we all experience throughout our day and throughout our life. Take time to enjoy life and enjoy each other, and try not to be critical of yourself. So try and focus on all the good that you are doing and not the one mistake that you may have made. Develop your emotional and spiritual support network. Let these people know who they are so that they're ready to help you when you need. And be aware of your mood. Talk to your healthcare provider if you feel that you're depressed. This is my last slide, just some community resources here. All of these foundations are really wonderful in providing a lot of information, great resources. Your county's Department of Aging and Disability Resource Center is a great resource for home health, adult day programs, transportation, meal service, etc. Thank you very much for your time.
Thank you so much, Dr. Eichenseer. We'll see you in just a few minutes for Q&A, but now I'd like to invite panelists for a panel discussion. Manak, whose wife Ro lived with Parkinson's disease for many years, and Tonia Smith, who's a care partner to her mother living with Parkinson's, to share their experiences. So come on up and join me on the stage. So we heard a lot of information about cognitive changes from Dr. Eichenseer. Could you share a little bit of some of the changes you may have seen in your loved one with Parkinson's?
So my mom, her care partner, was diagnosed in 2018. So fairly recently, and it wasn't until last December, that I noticed a level of awareness, or maybe thinking things had happened that actually had not. And I will have to say something that the doctor mentioned as far as that network, because it was family members that were already engaged that kind of clued me in. Hey, I talked to your mom earlier today and she sounded a bit off. So that's been critical, but it's been a fairly recent happening.
My wife was diagnosed in 1990 at the age of 36. So she had Parkinson's disease for 30 years. She died last summer. I noticed a few things, but I think the big thing is that her speech therapist noticed more. She was going in for speech therapy for one of the major programs, Speak Out, and she was noticing her ability to understand some things weren't quite right. Looking back on it, I noticed we had talked about some of the hallucinations she had. One of our dogs, we had 85 to 110 pound dogs, and one of them was her favorite. And she would see Mickey on a regular basis. That was looking back and noticing those things. There were some delusions, but you may not notice those right away, but it was things that were popping up. After a while, and we started getting some additional therapies in there, I could probably go through the MOCA test all by myself right now on this stage without even having the cheat sheet in front of me, because we were doing that so much to try to watch things. We would do things just to pay attention every morning. I'd ask her a number of series of questions. What day is it? What's today's date? Don't ask me what today's date is. That one I will never get right, but you could cheat. What time is it? I'd ask her what her birthday was. She would always get that right. So there are a lot of things she'd get right. So then I'd add things like, what's my birthday? How old am I? And the response always was, at that time, 68, you old coot. So she still had that ability to think about things, but there were other pieces that just weren't working quite right.
So to that, how did that impact you as care partner and also your relationship?
Ro was a really complex Parkinson's patient. She had DBS surgery that went bad. She had seizures. She was in a wheelchair. She was incontinent. But the cognitive things were the hardest because that was losing the relationship. And having those conversations, I'd still have some of the conversations. Executive function was the biggest issue for her. We refinanced our condo because we had to move from a 2-story house to a condo, and we were refinancing. I'd still talk with her about that. I don't think she ever balanced a checkbook in the 40 plus years we were married. But I did all the time. But we would talk about what this meant for us financially, why we were doing it. So I still tried to engage her, even though there may not be that interaction back. I think that was important from both her perspective and my perspective. So we just tried to do that, but the cognitive decline was the toughest part.
And for me, it was scary. It is as plainly as I can say it. It was very scary to know intellectually. I knew what the progression of Parkinson's could look like, but when it was happening, it was kind of terrifying. But education, something that was mentioned. I reached out to my mom's neurologist. Medications were prescribed, and we've moved beyond that, and she's doing quite well. But it was just really understanding and being able to have resources like friends from the Parkinson's Foundation, people that I can ask questions, people who have been living with this for longer, and just really like actively listening and understanding that there are resources available. So it's scary, but that's when it's time to kind of lean on the people around you and move on from there.
To me, it also connects to what Marlene had said earlier about grieving the loss and having to recognize and embrace kind of where Alicia and Nick had said, embrace where you're at, and by involving your wife in those conversations as well. Another facet of when there's cognitive changes is how can you still respect your loved one with Parkinson's and respect their independence? Can you share any instances or what you did with that?
Absolutely. My mom lives independently. She has her own home. So there's a fine line. And of course, I'm the child. I'm 49 years old, but that's a whole nother story. So to her, I'm the child. So a lot of times there's a dynamic there, and there's a shift in the dynamic as I'm calling her and saying, hey, how's it going? And like you said, Tom, kind of asking questions. Hey, what did you do today? She goes to exercise classes. What was the class? And kind of really engaging her to make sure that everything's okay cognitively and that she's just doing well. So there's it's a fine line that you have to balance, and in knowing your loved one, I'm sure it's different for everyone, but just understanding that respecting the dynamic, but also finding creative ways to kind of navigate and with awareness that there is a shift, and I'm caring for her now and making sure she's okay. And there's some dancing involved sometimes, but it works, and we've kind of come to a good place with that.
For us, it was trying to keep things as normal as possible in the normal situations. I did have a calendar that I printed out every day for her. It was color coded, so she would know what was going on. And then she would bring up things like, is it time for my Rock City boxing class? She loved hitting. And since I was held to target mitts, she loved hitting me. So she would always do that. Or because of the pandemic, we found some online singing classes, one out of state on Long Island. And she loved going to that one because singing songs that she could remember. But it was the classes, the boxing classes, the exercise classes, the speech classes, and then going to choir rehearsal. You could not hear her sing because her voice got so quiet, even though she practiced her speech all the time, but she was there participating. I'm a bass. My wife was an alto. When we go sing at church, I'm not close to her, but there were the other altos that took care of her and really tried to help her feel part of it. So we did those things. We got together with friends for dinner. The Saturday before she died, we had dinner with our choir director and played. She couldn't do games like we talked about earlier today. Games can be difficult. She couldn't do jigsaw puzzles anymore, but she was really good at a never have I ever game. And her wit was still there. So you have to find the right things that engage the person, your loved one. And we were able to do that as much as we could.
Thank you. Dr. Eichenseer touched on some of the coping strategies and ways that we can support our loved one with Parkinson's. Can you share any that have been helpful for you?
I think it goes back to what I just said. I tried to do things to make her day as normal as I could, to make her feel good about her life and what was going on. We don't have any kids. I live in the Chicago area. The family that I do have is up here. Oh, by the way, I would not wear my Green Bay Packers shirt today, Nick. I know you wore purple today, and I know football isn't big. I'm from Waukesha, and you know I'm from Waukesha because I say Waukesha. And I go to get a drink from a bubbler, so I'm in my home area at this point. But it was trying to make her day seemed like a day that we would have 20, 30 years ago. The one regret, and I think about this a lot, is no matter where your loved one is, don't always think of yourself as a care partner. Think of yourself as a daughter. Think about yourself as the wife, as the husband. Hold hands, snuggle. It doesn't necessarily mean sex, but think about those other things so that you're close. So you're not just in that role of care partner. And focus on that a lot, and then try to make their life as good as possible, but trying to maintain your life at the same time. I would get up I'm a morning person. I'd be up at 5:30 in the morning working out every day, and then I would get row up in the morning. So try to do those things for yourself so that you can then be there for your loved one.
And coping strategies that I'm learning and beginning to develop in relation to my mom, encouraging her, of course, to practice mindfulness, taking just time for herself, quiet time, as well as having that network. She works out. I'm from Cincinnati. She works out. She has a group of friends who most are living with Parkinson's disease. So she has that social network now. I'm so relieved and happy because it wasn't there for a while. So that's been a really wonderful way for her to get away from me and kind of have other people to talk or to speak with. For myself, it's some of the same things: mindfulness, time for myself. I love walking, and that's just an opportunity for me to just think about my day, things that I'm dealing with. And that's been a wonderful release for me, as well as just exercising and doing all the things that I've always enjoyed doing. And the most important part is making the time to do that and prioritizing my mental health in the process.
Wow, thank you guys so much for sharing some of your story. Now we'll move to Q&A, questions and answers, and like to invite Dr. Eichenseer back to the stage. And if you have a question in the audience, feel free to raise your hand and our colleague Laura will come to you. Online audience, use that Q&A box to submit your questions. I know we've had some questions come in that we weren't able to address from the previous presentation. So I encourage you to reach out to our helpline, 1-800-473-4636, or you can shoot them an email as well, and you'll talk to Parkinson's specialists. So go ahead with our first question.
This question is for Dr. Eichenseer. How important do you consider the DAT scan? And if your person with Parkinson's needs like neuropsych testing, how often do you recommend it?
Sure. Can everyone hear me?
Mm-hmm.
Okay. So just to backtrack a little bit, so a DAT scan is a nuclear medicine scan that is sometimes used in the setting of Parkinsonism to help differentiate between neurodegenerative forms of Parkinsonism, with the most common being Parkinson's disease, or other things that potentially can cause Parkinsonism, like medications, vascular changes, et cetera. I will say, so the gold standard for diagnosing Parkinsonism is still based on the neurologic exam. So in most people, I do not think they need a DAT scan unless there's something unusual, an instance where someone's maybe on a medication that can cause drug-induced Parkinsonism. And clinically, I'm not able to differentiate between those two things, or if someone's not responding to the medication, et cetera. I will say early on in the disease, the DAT scan is no better than the clinical exam. So you can end up with a normal DAT scan and then years later still have Parkinsonism. So I think it has limited utility, but in some instances, yes, can be beneficial. And the second question was about neuropsychological testing. So neuropsychological testing is done with neuropsychologists. It's a pretty, it's a long day for people. It can be, 4 or 6 hours worth of testing, where they're basically looking at the different domains that I discussed: executive function, visuospatial function, attention, concentration, recall. It does provide very useful information, particularly as a baseline. When people are having cognitive problems, but sometimes we will get a neuropsychological testing as a baseline. And then depending on how that person is progressing or changing, then we may repeat it at a given time as well.
We have a question from online that came through earlier. And this came up, I think, because Alicia had mentioned, but then both of you mentioned, how are you able to meet people with Parkinson's that felt like they were your age in your area? How did you do that?
What has been helpful for me is through the foundation. I know it's mentioned on the agenda. I'm a member of the People with Parkinson's Advisory Council, representing care partners. And that really was the door opening for me to meet people who are my age, my demographic, maybe live in my area. And from there, just organically it's spread. And I've met so many people in my area. And even here today, connecting with you all, it's just many opportunities once you take that first step.
And in fact, that's how Tonia and I met, because my term on PPAC ended June 30th. But the other thing I'd suggest is care partner support groups. At the local hospital where I would take Ro for her speech therapy and some other therapies, not to see her movement disorder specialist, they had a support group there, and they'd separate the people with Parkinson's from the care partners. It did not ring a bell with me. It did not fit well for me on that one. But the COVID silver lining is that you can go to so many other care partner support groups. You can find them that fit well. The one that didn't fit was, I had been dealing with my wife's disease for 30 years, and most of the people at that care partner support group was less than 5. So just there wasn't a good fit. But I found one online. It happened to be in downtown Chicago, but I'm 30 miles west, that I met some people there that we hit it off really well. One time the social worker was late getting to the Zoom call, but the Zoom was able to start. Once she got on 15 minutes late, she didn't say a word for another 15 minutes because the three of us were talking about the issues that we were having to deal with that week, and those issues. And if you find the right people and spend the time, keep on looking. If you don't find them, keep on looking. But if you do find them, hold them close. I'm still very close to 2 of them that we still talk 2 to 3 times a week about Parkinson's disease and what's going on. So they become friends because you have a shared experience, and that's really important. And that's why Tonia and I get along so well. And if we don't, she'll find her own ride back to the airport today.
We're getting along like this.
Yeah.
I also want to add something that I've learned is sharing my story. So if you're on social media and, maybe you're doing a fundraiser for the foundation, or you're just commenting, or at moving day or something like that, or even amongst your friends, if you're not on social media, just sharing that story. And then people have come up to me and said, hey, I didn't know my father had Parkinson's, my siblings. So that's also a wonderful opportunity to kind of start that conversation. And you never know who's affected by PD until you do that.
I'd also just like to throw in that wellness and exercise groups are not a traditional support group, but can also offer that support and camaraderie. I see Rock Steady Boxing represented in the room. I'm sure they could tell you a whole story of all the people who have connected through their program. So that's something you can find on our website as well, or call the helpline to help find what's in your area. Do you have another question, Laura?
How do you know if it's the progression of Parkinson's with cognitive, or if it's just kind of stubbornness, like wanting to go on the medication, taking the medication once you're on the medication, doing the exercises, going for a walk, whatever. It's hard for me to get my husband, and I know it's not my job to get him to do what he's supposed to do, but it kind of is my job. But yet, like taking the medication 4 hours later, 3 hours later, not taking it at all. Is that part of the disease, or is that his personality? Or
Yeah, so apathy can be a very prominent feature in Parkinson's disease, and can be one that's very difficult to treat. So depression and mood disorders can also factor into that apathy. So we always encourage people to try and, optimize the mood. If there is depression, try and address it from that angle. With the dopamine medications, I would say I've had kind of a handful of people where that apathy has lifted, but generally speaking, it's still there. So it's kind of that fine line where you really want to encourage your loved one to do it, but not that you become like a nagging, spouse or so it's really difficult. And then of course there are different personalities too that enter into the mix. Personally, when I see people and when we have these discussions, the way I approach it is saying, well, okay, we're all adults here, and you know what you need to do to improve your life and to improve this disease and try and change the bottom line. We don't have medications to do that. So the onus is on you to take ownership of this so that your wife can be your wife. So, trying to just provide gentle, reminders, or without crossing that line where you're nagging or, then there's conflict. But yes, that can be part of the disease.
I'll talk about the nagging. My wife was 100% Irish, and she was stubborn as they get. But when it'd be time for, let's say, exercise, we'd work on her exercises. And then I'd say, okay, let's get on the exercycle. And she goes, I hate that machine. It was her idea to buy it. And so I would say, okay, let's try something else. And then I'd go back and say, it's time to get on the exercycle because we want to get your heart rate up. And she'd say, okay, let's do it. So you may have to pivot a little bit and then come back to it. Just try to figure out different ways to do it, as opposed to just saying, we're going to get on the damn exercycle.
And really quickly, sometimes it's the care partner, a message coming from us may not be as well received as a stranger in the grocery store, maybe saying, hey, I heard exercise really helps with Parkinson's, and you've been saying it for months. So maybe having that message coming to your loved one from different people other than you. And it's been helpful because some things that I've said, it's like, it hasn't been listened to, but then people in her class, or even getting to the exercise point, the neurologist says it, someone that she knows has said it, and then it kind of begins to resonate, but it does take time.
I also think that having, like you mentioned, that group, not everyone is a big group exercise person, but people, it's great. They show up for each other. So having that, maybe, trying to try out different groups and see if something resonates with your loved one. And then they start showing up for the other people in the class, not for themselves. Yeah.
Talk to those group members, tell them what's up.
Yeah.
See if they'll help with the messaging, maybe. Okay, we have time for 2 more questions.
Let's have a comment. The other thing with
Hold on one second. Let's get you the mic.
Like if they're supposed to use the bicycle and some other things during the day. Hey, here's a list of things you have to do today. Sweetheart, which one do you want to do first? You know, sometimes just giving a choice to someone so that their dignity and their self-esteem is not damaged by being told what to do, or, hey, we got to do this next. Give them a choice.
Right.
You know, have those 6 things for the day and say, hey, which one do you want to do? Except for taking your med on time. You have to do that.
Thanks for sharing.
Maybe a 2-part question here, totally separate from one another, but Doctor, you had mentioned something during the hallucination and delusion section that I probably should have asked my doctor before for my wife, but she suffers from both and the delusions are the worst. Have you ever focused treatment just on the delusional side of the equation, or are H&D always together?
Yeah, that's a great question. So the medications that we use really would target both of those components.
She does the rivastigmine and the memantine.
Yeah, so a cholinesterase inhibitor or the memantine. If those aren't adequate and the person is having very troublesome, bothersome, disruptive, hallucinations or delusions that are causing fear, et cetera, then sometimes we use some of those stronger medications that I mentioned.
And the second part of this is she hates medications. Her family hates medications. They challenge me and the medical community all the time about, well, we're fearful that what she's taking is causing a lot of this. So we have attempted over the last probably 2 years to cut back on some things, see what happens, because I know very well how it is with medications. You can only change one thing at a time. Wait a month or 2, then you change something else, and it's hard. It's very hard. Would that be something that you as a caregiver, a doctor, have to take the lead role in convincing that patient that these medications are absolutely critical, or this might happen? Or do you tend to stand back and let the time that it takes to find out whether something is working, do that talking for you?
Sure. Yeah, that's a tough situation. And certainly that does come up in the clinic. I often try and encourage, if there's particular family members or someone that's really kind of pushing the no medicine or don't do this, or I encourage them to bring them to clinic so that they can hear what we're saying, hear what I'm saying or what the other healthcare providers are saying, and really address their concerns or myths or whatever they've read online about these potential therapies, to try and get everyone on the same page. I mean, ultimately, if someone is decisional, I or a care partner can't force that person to take medicine. We can provide as much education as we can, but ultimately the decision is with that person, or if that person is not decisional, then the healthcare power of attorney would be making that decision. But still, obviously there are family dynamics to battle with that I don't see, when I'm in the clinic, but I try and address that too. So if we can bring in people that are raising these red flags, or what are their concerns, what are the myths that we can kind of dispel, and usually that helps to at least get everyone on the same page. Yeah.
I'm going to throw a wrench in there. Is there a telehealth option?
And I
bring
was just
people
going to
in?
say, now the silver lining of COVID, I mean, we were limiting how many people could attend, but there's no limit for how many people can attend virtually. So, I have had instances where you and your loved one are in the clinic, and then, whatever family member is then FaceTiming in, or, so that they can join in on the discussion or calling in on the phone to address those concerns.
You can find the clinic versus doctor's appointment?
Same thing, yeah. An appointment a doctor's appointment in the clinic, sorry.
You're not talking about the team of people in the clinic. meeting with you, that kind of thing, like one-on-one.
Correct.
Well, thank you guys so much for the wonderful questions. Thank you to our wonderful panel. Let's give them a round of applause. All right, and that concludes our program today. I appreciate you guys sticking around. I know we went over, but we had such great content that I think we'll just have to expand in the future when we offer this again, because I know this is definitely important to everyone. So just like to make sure that you guys share some of your information or what you gathered from today on that evaluation. We really, truly appreciate the feedback to help plan our programs in the future. So in person, we've got paper evaluations online. You'll see that pop up as you close today's program. We'll also email the link of the recordings and the slides and some of the resources we talked about in the next week or so. Thank you again to our generous sponsor, Acadia, for making today's program possible. Thank you to our wonderful speakers today, Alicia Peters, Nick Campbell, Dr. Eichenseer, Marlene, Perdan, now I'm really tongue-tied. Marlene, Perdan, Tom Manak, and Tonia Smith for sharing so much of their story. You guys are so appreciated. And last but not least, thank you to all our care partners joining us here today. Thank you for the love, dedication, time, and care that you give to your loved one with Parkinson's. Have a great rest of your day.